for your introduction, and dear colleagues. It's my privilege to report currently conducting cluster randomized trial. We name it Healthy Family Program on population blood pressure. I'm a cardiologist, work at Beijing Anzhen Hospital. I also the director of two non-profit research organizations, Heart Health Research Center and the Ruyang Rural Health Institute. For many years, we believe the responsibility of blood hypertension management is the role of healthcare professions. However, this approach has not been successful. In 2018, the survey showed over 50% of hypertension patients are unaware of their hypertension condition, and only a small proportion of patients achieve good blood pressure control. And early in this year, the State Council of China launched the Healthy Family Program, which emphasizes each person is responsible for his own health. And among many objectives, 2 key goals including to train 1 to 2 family health instructor for each village, and at least one member in the family is capable of measuring of body temperature and blood pressure, and knows when to see a doctor, and how to achieve these goals, and whether a community-based rather than a medical care-based blood pressure management strategy would help to improve blood pressure control among populations in underdeveloped rural area is uncertain. And this study is a parallel group cluster randomized trial conducted in 80 villages in Ruyang County in Henan Province. The study population is aged 40 to 80 years from 50 randomly selected families in each village, regardless whether they have hypertension or not. The intervention is a multi-phased intervention, include blood pressure and weight monitoring by housewife through an APP, and seeking antihypertensive drug treatment when necessary. We provide free low-sodium potassium supplemented salt, and we ask the health instructor to guide the villagers to do physical exercise, and all those interventions will be implemented by the health instructor in the village. The control group will use Euro practice, and we develop the blood pressure monitoring algorithm, which require if the villager's blood pressure is higher than 160 over 100, we will ask them to monitor their blood pressure in the next day. And if persists, we ask the housewife and the health instructor to guide the villager to seek medical care. And if the blood pressure is optimal, like less than 120, it's fine. We will ask the villager to measure their blood pressure in 1 month. So they will surveillance their blood pressure in the long term. The primary outcome is a change in systolic blood pressure from baseline to 6 months, measured by the investigators rather than self-reported. The secondary outcome is change in systolic blood pressure from baseline to 12 months. After 6 months, the intervention will be withdrawn, and the 12 months will test whether the effect of the intervention will persist to 12 months. And the other secondary outcome include change in diastolic blood pressure, percentage of participants with blood pressure higher than 130 over 80 at 6 months, and change in weight and the incidence of MACE. And the current status, we launched the study at April this year, and here's a photograph of we educated the villagers, and the health instructor guides the villagers to do exercise, and I myself and my team go to see the health instructor in the villages. This is the self-reported blood pressure in the APP. And at baseline, we see quite a high proportion of patients got uncontrolled blood pressure. And this is real time, we can see they upload the blood pressure. We can see the blood pressure level decreased a lot. And this month, we began to collect the endpoint. And we need 3 months to finish that and look forward to report to you after that. To improve the health globally by studying health locally is our mission of the Ruyang Rural Health Institute. We invite all of you to come to Ruyang to see the change in rural China. Thank you so much.